Hi everybody, so today we're going to be talking about pacemakers. So let's go ahead and get started. And before we get started, we have to go over some anatomy of the heart. So what you're looking at here is a person, and this is their left side. Just like this is my left side, this is the right side over here. This is the heart, and you can see I obviously have the heart drawn really large, okay? But this is what's going to happen is blood's going to come in. I'm going to label all this stuff in just a second, but this is going to be the right atrium. So blood's going to come into the right atrium from the body or from the head. Then it's going to go into the right ventricle. Now, I don't have it drawn, but when the right ventricle pumps, the blood's going to go out to the lungs, which I don't have drawn also. Then it's going to come back into this right here, which is the left atrium. Then from the left atrium, it's going to go into the left ventricle. And then from here, it's going to go out to the body. So now, inside the lungs, inside the heart, we have something called an SA node. It's known as a sinoatrial node. It's going to be right here by this vein right here. And this vein is what we're going to call the superior vena cava. That's the superior vena cava. And this is how blood from above the heart gets into the heart. You have an inferior vena cava, which we're not going to be talking about. But that brings blood from the rest of the body into this right atrium. So here's my SA node. And it stands for sinoatrial node. It's going to be right up here, right by this, where this superior vena cava enters into the heart. And this is known as the pacemaker of the heart. So what it's going to do is it's going to make the heart beat. Now, the thing about this is this contains special cells, so it's basically nothing controls it to make it cause an impulse, okay? Nothing controls it. Now, you do have nerves called vagus nerves, which can actually speed it up and slow it down. But for the most part, this decides on its own when to create an impulse, okay? Now, here's what's going to happen is when the SA node or the pacemaker sends an impulse out, it's going to send it out in nerves that's going to go out to these atria right here, right? And this is actually the nerves that are coming out this way. It's actually called Bachman's bundle, but it's going to go out to here. And what they're going to do is they're going to cause the heart to contract, okay? The heart's going to contract. Now, eventually what's going to happen is you are going to have those nerves eventually are going to send an impulse, so the atria contract, and eventually they're going to come down to this orange thing right here. And this orange thing right here is going to be called our AV node. So I have a sinoatrial node, then I have an atrioventricular node. If you notice here, we said these are the atria, these are the ventricles. The AV node is kind of down here, tucked in this little corner here. And that's why they call it the AV node, because it's right by the bottom of the atria and the top of the ventricle. So now, the impulse is going to come out, the atria are going to contract. The thing we don't want is we don't want the bottom of the heart contracting the same time as the top of the heart, because blood's got to get from here down into there. So if they both contract at the same time, then we can't get the blood in here, because it's basically going to be closed, right? So we need to hold that impulse for just a minute, or just about a portion of a second. So for about 1.1 seconds, we are going to stop this with this AV node right here. So the AV node is going to stop that. Now, after this contraction, the blood has come down in here. Now this impulse is going to be released. So the way the impulse is released is it comes down into something called the bundle of His, which is basically going to be nerves. So this is going to be the bundle of His. Some books will actually call this the AV bundle, but it was discovered by a guy named His, just like it sounds, H-I-S. Now what it's going to do is this right here is called the interventricular septum. Okay, and basically what it is, it's a thick muscle that's going to divide my right and my left ventricles. So this is going to bifurcate, and it's going to come down like this in these bundle branches. All right, so we're going to call this is going to be my right bundle branch, that's going to be my left bundle branch. So we're going to call these bundle branches. Okay, and again, that's the right, that's the left. Then they're going to come down, and they're going to be down here, and I'm going to show you what this is made of in just a minute. But coming off of these bundle branches, you are going to have more nerves. And these nerves, let's use green. These nerves are going to be called Purkinje fibers. So these green are my Purkinje fibers, right? Named after Dr. Purkinje, right? So So then what's going to happen is these are actually sitting inside the heart muscle. So let's go like this and just say this is our heart muscle right here. And what's going to happen now is they're going to send the impulse out, and they're going to make the bottom contract now. And now the blood's going to go either to the lungs, like we said, from this right ventricle, it goes to the lungs. From the left ventricle, it's going to go out to the body through the aorta. And I actually have videos on the aorta. Okay, so that's what's going to happen. Now, this SA node will usually make the heart beat somewhere between 60 to 80 times a minute. Okay? If it starts to slow down, we call that bradycardia. And if it slows down too much, what's going to happen is you're going to need a pacemaker. So here's what they're going to do with the pacemaker. Is over here, I actually should have this drawn, or well, actually it's okay right there. So I'm going to have these arteries or these veins coming back from the body, right? And you're going to have something called your axillary vein. Your axillary vein is going to turn into your subclavian vein. So what they're going to do is right here you have your clavicle, and below the clavicle a little bit, they're going to peel the skin back, and they're going to put what they call a pulse generator in there. So we're going to put this, my pulse generator is going to be right about in here. All right, and this is going to be the pulse generator. All right, now here's what's going to happen is from this pulse generator, they're going to have leads. They're going to have wires that come off of this. And depending on how much they need to do here, depends on the number of wires that they need, right? So we're just going to look at the first one first, okay? So here's what's going to happen. Eventually, this axillary vein is going to go below the clavicle, right? Actually, it's when it gets past the first rib, but it's going to go below the clavicle. So this is going to be called my subclavian vein. And if you don't know what the clavicle is, that's your collarbone. All right, so this is my subclavian vein. Now, they're going to take this wire, and they're going to go in through here. Let's use a different color here. Let's go with, I guess we'll just stick with black. So we're going to use this wire here, and then it's going to come. Now, this is my internal jugular vein right here. This is bringing blood down from the head. When we get past that, this is actually going to be called my brachiocephalic vein, okay, right here. So again, so this right here is going to be my internal jugular, and then when we get the subclavian goes past the internal jugular, it's now called the brachiocephalic vein. And then what's going to happen is it's going to come down, it's going to join the brachiocephalic vein on this side to form the superior vena cava. And then the blood's going to drain in. So what they're going to do with these lead wires is they're going to come down, and then what they'll do is, if we just need to speed up the heart, what they'll do is they will insert that into the wall of the right atria, right? They're going to insert it into the wall of this right atria. And this right here is called my interventricular septum. So I'm sorry, interatrial septum. That's the interatrial septum. That's the interventricular septum. Okay? So let's take a look at this real quick of what they're going. Well, let's go ahead and finish this. So then what they'll do is, depending on how much is needed, they'll actually put a second wire in here, which will come in, and then they'll actually go through, you actually have a valve here that opens up when the heart beats. They'll go through that, and then what they'll do is they'll go into the wall here. This is actually all covered in muscle, just like we saw here. Then what they'll do is they'll actually have another lead go in there. Now, sometimes what will happen is the ventricles won't contract at the same time. So one will contract and then the other, one will contract and then the other. We don't want that. We want both the ventricles to contract at the same time. If that's needed, then what they're going to do is something that's going to be called cardiac. It's going to be called cardiac resynchronization therapy, also known as CRT. Okay? So then what they'll do is they'll actually have another lead that's going to come in over on this side, and they'll insert that. So now I can get my ventricles to contract at the same time. So if the ventricles are not contracted at the same time, they're going to put a different type of pacemaker in called the cardiac resynchronization therapy, and then they're going to have that in there to make sure these contract at the same time. So let's take a look at this real quick of how this works. We've already talked about how the SA node just sends signals out through nerves to different parts, right? Over here we called it the Bachman's bundle, which is going to basically cause the left ventricle or the left atria to contract. And then over here we have these nerves, which they actually call the internodal pathway, which is going to make this contract. So these two are going to contract at the same time as this holds this up and blood goes down to there, and then we want these to contract at the same time. So here's what's going to happen. Okay, now we get these leads that are in here. What I'm going to do is I'm just going to take a cross section right here of this heart wall, and we're going to look at it over here. So when they go to do this, what's going to happen now is we have that lead coming in. There's two things with that we can have, right? This is the lead from the pacemaker. There's two things that can happen. Now I could still be in the atria, or I can be down here in the ventricles. I'm just taking a cross section here, but I could be taking a cross section from here or here. It's all the same. The first part here, what you have is a very thin line, and it's only one cell thick. And these are called endocardial cells. This is known as your endocardium. So, and it's made up of endothelium. So my endocardium is made up of endothelial cells. So this is my endocardium, and it's just a smooth layer there. This here is my myocardium. And the myocardium is the muscle layer. Okay, so this is my muscle layer. And this is the part that's going to contract when the heart beats. So what they'll do is they'll take this lead from the pacemaker, and then they can do one of two different things. This lead could have a little, almost like a little coil on it that they can just coil into there, or it can actually just have what they call tines, which they'll do, and then kind of just stick it on there. And then the electrical impulse is going to come from the pacemaker into here, and it's going to cause these to contract. Now, what's really cool about cardiac muscle is what I'm going to do now is I'm just going to take a little section of this, right? Let's just say this little section right here. I'm going to blow it up, and now it's here. These are muscle cells here. So now, this is a muscle cell. I don't have the nuclei drawn in there. Usually there's 1 to 2 nuclei that are in there. So here's a muscle, here's a muscle. But if you notice these blue areas, these are called intercalated disc. And what these are going to do is as the impulse comes in, these are going to work differently than your skeletal muscles, which need their own impulse. As this impulse comes in, that electrical impulse is sent in, these have little what we call gap junctions, right? They're going to have little gap junctions. So now my impulse can pass from one muscle cell to the next muscle cell, right? And so what this does is it makes all these contract at the same time, because this goes past here real fast, right? So that's what the pacemaker is going to do, is it's going to be right in here because the SA node isn't working properly, right? At the same time, what this is going to do is it's going to send signals back to this pacemaker here, right? And it's going to monitor how fast the heart is beating on its own. Once you get to have a pulse of greater than 60 beats per minute, right? Once you get greater than 60 beats per minute, this will actually stop sending signals because now the SA node is taken over. And then if it goes down, this starts to work again. So that's the way that the pacemaker is going to make your heart work, okay? So anyways, that's it for pacemakers. Thank you so much for watching. If you enjoyed the video, please hit the like and subscribe button, and we will catch you next time. And I'm going to leave this up here for just a few seconds so you can take a look.